Hello, it's the biology doc again for Trust Me I'm a Biologist, and we are still talking about cardiac access. This is video 2. In the first video we talked a little bit about how the electrical wave of depolarization propagates throughout the heart, and we finished off by drawing the hexaxial diagram here, otherwise known as the Cabrera diagram. And today our job is going to be to learn how to interpret cardiac access and not just understand what it's all about. So what we've got over on the left-hand side of the screen here as you're looking at it is an ECG. We've got lead 1, lead 2, lead 3, AVR, AVL, AVF, which are all the leads that you can see over here in the hexaxial diagram. And on the right-hand side of the screen you've got the chest leads, V1 through to V6. In order to determine cardiac access, we've got a couple of rules that we need to follow. And the first rule is, one here, and that is ignore leads V1 to V6. Okay, so we're not even going to consider these when we're trying to interpret somebody's cardiac access. Now, you'll recall from the first video that the cardiac access is actually the mean electrical vector that is propagating through somebody's heart. So if we just very quickly draw in a mini rudimentary heart down here, we're in a conduction system, Purkinje fibers, there like that. As the wave of depolarization leaves the sinoatrial node and propagates throughout the atria, it gets picked up by the atrioventricular node, pushed down the bundle of hissin into the Purkinje fibers. So we've got millions of individual electrical vectors all firing off as the wave propagates throughout the atria, as it gets picked up by the atrioventricular node, and as it starts to make its way down the bundle of hissin into the Purkinje fibers. And what we're trying to do with the hexaxial diagram is to figure out what the mean vector is. Just a quick reminder, what is a vector? A vector is something that's got magnitude and direction. So if we have that plus this, it implies we got a resultant that is this, which equals this. Okay? So, first thing you do is just get rid of this. So I got a bit more space to work with. And okay, so on our ECG, we need to look for a couple of things. We've got like I said, we've got rules that we've got to follow. So the first one is to ignore V1 to V6. The second one is we've got to find an isoelectric lead. Okay, now an isoelectric lead is one that has a QRS complex for the uninitiated. ECG will kind of look something like this. We've got an isoelectric line, we've got a P wave, we've got a QRS complex, and we've got a T wave. This represents the depolarization of the atria, this represents the depolarization of the ventricles, and this represents the repolarization of the ventricles. The atria repolarize underneath the QRS complex, but it is masked because the QRS complex is so big. So we're looking to find an isoelectric line, an isoelectric lead. Then after that, we want to look for, using the hexaxial diagram, the leads at 90 degrees to the isoelectric lead. Okay? Then after that, we need to ask ourselves a question. Which one of these leads has got a positive and which one has got a negative QRS? Okay? So now you need to start thinking to yourself, well, why? Why have I got to do this? So we are dealing just with electrical vectors. Okay? And you need to think to yourself, about what this actually means when you're interpreting a graph, because don't forget, an ECG is just a graph. Well, it's 12 graphs at the same time linked to a map, but basically at its heart, it's just a map. Okay? So if we've got, imagine yourself standing with a telescope. Imagine yourself standing with a telescope on a train line, looking down the end of your telescope at a train that's coming towards you. Now, if that train is coming towards you, it is going to get bigger. It's kind of like perspective. Yeah, as something comes towards you like this, it gets bigger. Okay, so this is the front of the train here, train driver's window, and it's getting bigger as it's coming towards you. Similarly, if the train is going away from you into the distance, it's going to get smaller. And the same thing happens with your electrical vectors. As that electrical vector is coming towards you, the wave of depolarization, if it's coming towards the electrode, so this is the positive end of the electrode down here, this is the negative end of the electrode down here, positive end, negative end, positive end, negative end. If it's coming towards you, if the wave of depolarization is coming towards you, let's just take lead 1 for example. If you're standing with a telescope down here looking at lead 1 and the electrical vector is coming towards you, it's going to be getting bigger. And that will be shown with a positive QRS complex. Okay? If the wave of depolarization, if you're standing with your telescope metaphorically looking down lead 1, if the wave of depolarization is going away from lead 1, then that'll be shown with a negative QRS complex. Now you're thinking to yourself, that's all well and good, but you've told me to look for one that is isoelectric. So why have you told me to look for one that's isoelectric? Well, I told you to look for one that is isoelectric because, using our train analogy, it means that the wave of depolarization is going neither towards nor away from that lead. So if it's going neither towards nor away from that lead, it's got to be at 90 degrees to that lead. So, coming over to our ECG, what you should be able to see is that we've got an isoelectric QRS complex here in lead 3. You can see that the QRS complex is above and below the isoelectric line here. Okay? Going back over to our hexaxial diagram, we can see that lead 3 here is running at 90 degrees, there or thereabouts because of my poor drawing, to lead AVR and to lead 2. So what we're going to do is we're going to write into here that this lead, lead 3, is our isoelectric QRS. So we've done rule number 1, we've ignored V1 to V6. We've done rule number 2, we've found an isoelectric QRS complex. The next thing we have to do is to find the leads on our diagram that run at 90 degrees to lead 3. So if I just draw in these leads in isolation down here, lead 3, and then we ask ourselves on the diagram, what leads run at 90 degrees to lead 3? It's lead 2 and lead AVR. So, going back up to the ECG, we now look at lead 2 and we look at lead AVR. And what we can see is that lead 2 has a positive QRS complex. You can see it here. You can see the isoelectric line, and that lead 2 has a QRS complex that is mainly above the isoelectric line. Lead AVR over here has got a QRS complex that is mainly below the isoelectric line. So we can write into here on our diagram that that lead 2 has a positive QRS complex and lead AVR has a negative QRS complex. So thinking again about the little train analogy that I was talking about, if we are thinking about which way this mean vector is coming, it is getting bigger as it is coming towards lead 2. That's why lead 2 has got a positive QRS complex. It is getting smaller when you look down the telescope at AVR, which means the mean electrical vector, if we go back and just think about our heart, is an atria, ventricle, atria, ventricle, not my best heart, bundle, atrioventricular bundles, AV node, bundle of His, and Purkinje fibers. It means that as this heart is depolarizing and the wave of depolarization is spreading through the atria, down into the atrioventricular node, down the bundles and into the Purkinje fibers, the mean wave of depolarization is running this way. It isn't running this way, it's running this way. So that means the axis of the heart, the mean depolarization vector, is running towards lead 2, down this lead. So, on its own, in isolation, that doesn't really mean a lot, but what we can think about with this diagram is as follows. I'm just going to change color here a second. I'm going to put this green. If the vector, the mean depolarization vector, runs from lead AVF, which is at 90 degrees, through to AVL, which is at minus 30, and I must apologize, I think in my previous video I labeled that as plus 30, which is very uncharacteristic of me. But it was my first video, so give me a pass. So if it lands anywhere in this cross-hatched area, the axis of the heart is normal. Now if we draw a dotted line up here to minus 90 degrees, if the mean depolarization vector lands anywhere in this little quadrant here, then the patient has got left axis deviation. If we land anywhere in this quadrant here, then let's do a color change. We'll do red for this one because it's important, because we're going extreme. If we get to this, which is anything from 180 degrees up to minus 90 degrees, then that patient has got extreme right axis deviation. And if we're into, I don't know, let's use some, because I've got my pen near it, pink, from 180 degrees down to 90 degrees, then we've just got right axis deviation. So what we can see from this diagram is that we've got a positive deflection at lead 2, which means that the axis is coming into this region here, which means the patient has got normal axis. So, summing up, you ignore leads V1 to V6, you find the isoelectric lead, you look at the Cabrera diagram and the hexaxial diagram, you see which leads are running at 90 degrees to the lead that you identified, you find which one has got a positive QRS complex, which one has got a negative QRS complex, you apply it to the diagram, and you make your differential diagnosis of the normality of axis deviation. As always, if you've got any questions or you know of anything else you'd like me to talk about, leave some in the comments below, subscribe to the channel, let's learn some more physiology together, and I'll see you next time.